Good afternoon, everyone, and thank you for joining us for today's Financial Wellness webinar sponsored by Acorda Therapeutics, New Year, New Financially Secure You. Today's housekeeping tips are that today's audio, the webinar for today's I'm sorry, everyone. Let me start over. I'm just so excited to be with you today. The audio for today's webinar is being broadcast through your computer. Please make sure your speakers are turned on or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel. If you accidentally close the panel, you can reopen by going to the communication menu, which is at the top of the screen, and choosing Join Audio Broadcast. If you do not have sound capabilities on your computer, or if you prefer to listen by phone, please dial in. The phone number is toll-free 855-244-8681. The meeting code is 666-644-411, and you do not need to enter an attendee ID. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right-hand corner of the webinar platform. If you want to make the Media Viewer panel larger, you can minimize other panels like chat, Q&A, and/or participants. We hope that you'll submit questions during the webinar. To do so, please use the chat box or the Q&A box to send any questions you have at any point in time during the webinar. You can send those to myself, Elizabeth Jennings, or to Nakia Matthews, and we will direct the questions accordingly during the Q&A portion. If you are listening by phone and you are not logged into the webinar, you may also ask questions by emailing them to me, Elizabeth Jennings, at ejennings@ndi-inc.org. We also want to make sure you know that this webinar is being recorded and the materials will be placed on the National Disability Institute website at realeconomicimpact.org/financial wellness. If you experience any technical difficulties during the webinar, please use the chat box to send a message to the host, Nakia Matthews, or you can email Nakia at nmatthews@ndi-inc.org. Okay, so now let's get started. Good afternoon, everyone. My name is Elizabeth Jennings. I'm the Director of Training and Technical Assistance here at National Disability Institute, and I will be your moderator today. We have several guest presenters that I'm thrilled to have with us. Richard Keeling, a Senior Tax Analyst with the IRS, Mike Wade with the SPEC National Partnerships at the IRS, and Lori Shaler, Manager of Financial Empowerment with us here at National Disability Institute. We have a jam-packed agenda, so we're going to try to go through some of our previous slides rather quickly. Those slides include an overview of financial wellness in individuals with MS, and then we're going to dive right into favorable tax provisions, some free tax preparation options, the health insurance marketplace, individual shared responsibility provision, health insurance premium tax credit, and then we're going to give you lots of resources. We try to leave plenty of time for Q&A, but we have so much material to share with you today that if we don't get to your question, I just want to remind you to please email them to us. And again, my email is ejennings@ndi-inc.org. A special thank you to our sponsor, Acorda Therapeutics, who makes the MS Financial Wellness webinar series possible. For those of you who are new to us, National Disability Institute is a national research and development organization with the mission to promote income preservation and asset development for persons with disabilities and to build a better economic future for Americans with disabilities. We focus on financial wellness and define financial wellness as the state of a person's finances with the intent of working towards financial behaviors that limit stress and the impact of stress on one's daily life. And those of you on the line who are living with MS know how important that can be to limit stress. We've also focused on financial wellness because we believe it impacts mental and physical health, that it positively impacts self-concept, that it can change your status with other community stakeholders and give you an increased quality of life and increased community participation. When we talk about financial wellness, we're really talking about several things. We're talking about being financially literate, accessing affordable financial services, utilizing favorable tax provisions, which we'll talk about today, budgeting, understanding public benefit rules, building and maintaining assets, accessing available healthcare subsidies, and understanding work and long-term disability options. Although we're not going to talk about all of these things today, we have done webinars on each of these topics, which you can find on the website, realeconomicimpact.org/financial wellness. But before we started the Financial Wellness webinar series, we did a survey with our partners at MSAA to better understand the impact of MS on individuals and specifically the impact on their finances. And while we have so much information to share with you today, I'm not going to share all of the statistics with you. I wanted to just share a few. One is that when individuals with MS were asked about their ability to pay all of their bills in a typical month, 32% reported having a very difficult time paying their bills, and almost 47% reported having a somewhat difficult time, meaning that almost everyone reported having some challenge. Also, 43% reported that their financial status had affected their ability to access medical care at some point in time. Critically important to financial stability, almost 72% reported they did not have enough savings to cover 3 months' expenses, and almost 68% reported that their finances were worse since their MS diagnosis. We also found that a large number of the people who responded to the survey, almost 74%, reported that they were not aware of financial stability programs such as the Earned Income Tax Credit, which we're going to talk about today, individual development accounts, family self-sufficiency programs, and the PASS plan, which is a Social Security work incentive, all of which we've discussed on some of the financial wellness webinars. But the real reason why we do these webinars and why we think they're so important to anybody who's covered by the ADA is because the promise of the ADA is to assure equality of opportunity, full participation, independent living, and economic self-sufficiency for such individuals. And in this year, in which we'll celebrate the 25th anniversary of the ADA, we can see no better time than now to continue to talk about the importance of financial wellness for all individuals with disabilities. There are a lot of strategies that can be applied, and we've listed some of them for you today. Some of the most important ones can be understanding public benefit programs, which again we have archives on realeconomicimpact.org/financial wellness, and the crux of our conversation today, using favorable tax provisions and accessing free tax preparation services. And with all that, I'm really thrilled to hand it off to our guest presenter, Richard Keeling, with the IRS. Richard has been such a wonderful partner with us here at National Disability Institute, and we're just so grateful for your partnership, Richard, and for your presentation with us today. Oh, Richard, let's hear you talk one time and see if we can hear you. Okay, we're having a little bit of technical difficulty. So now Richard's muted. Okay, let's try one more time. I can see you're talking, Richard, but we can't quite hear you. Well, please forgive us, everyone, as we just tackle this moment of technical difficulty, which those of you who join our webinars frequently know doesn't actually happen to us too often. So, Richard, again, we can see that you're talking, but we still can't hear you. Well, thanks, everyone, for bearing with us. Nope, that's just me. I thought we had Richard, but it was just my echo. Okay, I'm going to see if I can ask for just a moment for our host, Nakia Matthews, if you could just give me a little bit of guidance on what our next step is here.
Hey, this is Nakia. I'm trying to get Richard to connect with the phone, so give me 1 second.
Okay, great.
Thanks, everyone.
So you know what, in the interest of time, and because we do have so much great information for you all today, I just wanted to take a moment to let's go over our next steps that we would have covered at the end of the webinar, because we don't want you to lose time on being able to ask your questions. So each time we do one of these webinars, we try to give you some suggested next steps, things that you can do after you've learned all you can from the webinar. So here's some next steps that we'll offer now that you can utilize tomorrow or after you've had a chance to process what you've learned today. The first is that we're going to offer you several free tax preparation services, and we're going to suggest that you identify the one that's right for you so that you can get your taxes done free, and you can use those supports to identify favorable tax provisions that may apply to you. The next step we'd like to recommend is that you review the webinar archive, taking a first step toward improved financial wellness. We did this webinar several months ago, and it's archived on our website, but this webinar was done with the support of Marlene Ware, who provided some really fantastic step-by-step guidance on how you can take the time to get your finances organized. And she gave tips right down to the kind of tools you might use to organize your finances and the things that you can do to take some first steps towards improving them. She gave guidance not only on accessing great budgeting tools, but also on tackling down credit. And at this, the start of a new year, it's really a fantastic time to take a moment to think about how you're going to get that all organized for a new year, especially when you're doing your taxes and you're finding that things weren't quite as easy to find as you would have liked them to be. Also, taking that look at your finances may help you have a different lens on what you want to use any kind of tax refund that you get so that you are making a really informed decision about what you want to do with those funds. We also suggest that you set a goal to complete those two things over the next 3 months. And we like to reach out occasionally and see if you'll share with us what you did. For those of us working on financial stability, we know that the people who are best at really educating us on how to get some of these financial issues tackled are those who are tackling themselves, right from the grassroots level up. So I think I see that Richard is now connected, and I'm going to get you back to your starting point, Richard. And thank you again for being with us today, and see if we can pass this off to Richard.
Hi, Elizabeth. Can you hear me okay?
I can hear you. Welcome, Richard. Thank you so much.
Thank you. Thank you for being patient. It worked yesterday on the computer, but I don't know what happened. But anyway, welcome everyone to this webinar. And my name is Richard Keeling. I work out of the National Partnerships Group out of Atlanta. However, I've been in Florida for the last little over 2 years now, working with disability organizations such as National Disability Institute and many others. And just to give you a little background on myself, I did present on this a similar webinar with people with MS and the MS Society a few years ago. And I am a person with a disability. I was in a diving accident when I was 16, and so I've been in a wheelchair since then, which will be 40 years in July. And also, I want to mention my sister was diagnosed with MS in her early 20s, and she has been in remission for the last 20 or so years after having to take shots every day. And she's lost the use of one hand, her right hand, because of MS, and she's progressing well. She's a year older than me, but I now help difficult things can be for her. And she was the one that influenced me to move to Florida because of, she lived in Rochester, New York, and it was very cold up there, to say the least. So that's just a little bit of background. And now I'm going to give you a little bit of background on our organization. Not too much, but the organization that we work out of is the known as the Stakeholder Partnership Education and Communication Group. And we are basically the outreach and education arm of the IRS. And part of the things that we do, I'll go over in a few minutes, but we do manage the Volunteer Income Tax Assistance Program and the Tax Counseling Elderly Program, which is free tax preparation for various groups, and I'll talk about that in a minute. I don't know if Elizabeth, can I advance my slides myself, or do I have to? Yeah, okay, there it goes. So our SPEC business model is leveraged through client-based organizations, and the model integrates on the slide, if you can see, tax education with free tax preparation and other strategies promoted by our partners to increase income, build savings, and gain and sustain assets for targeted SPEC customers. And the first piece, the tax education piece, obviously about providing information on available tax credits, especially the earned income tax credit, which I will talk more about in a few minutes. And I've already mentioned our tax preparation services with our Volunteer Income Tax Assistance Program and Tax Counseling for the Elderly Program, where we have more than 12,000 of these sites where tax return preparation is done face-to-face. And last year, our program prepared over 3.6 million tax returns for people, and that consists of working with people with disabilities, people that have low to moderate income, Native Americans, and many other segments of the population. So overall, our model is working with these three organizations, including probably the most important one to our partners, which we call financial education and asset building. And most of the financial education and asset building is offered through our external partners at Select, VITA, and Tax Counseling for the Elderly sites. Through this leverage approach, we do work with partners that have a commitment to increase the economic well-being of the shared customers. And overall, our desired outcome is we want all taxpayers to be aware of asset building opportunities linked to tax return preparation. And we also want eligible taxpayers to use our free tax preparation services and take advantage of asset building opportunities. So with that, I do want to mention the earned income tax credit just because of the size of it and how it is utilized. And I'm going to give you a little bit of background on this credit. It was first enacted under the Ford administration by the Tax Reduction Act of 1975. And originally, the EITC, the earned income tax credit, was supposed to be a temporary refundable tax credit for lower income workers to offset the Social Security payroll tax and the rising food and energy prices during that time. The credit was made permanent in 1978, and since then, the earned income tax credit has been considered both an anti-poverty program and an alternative to welfare because it incentivized work. 26 states currently have, including District of Columbia, have created the earned income tax credit for states to help families struggling by and getting by on low wages to make ends meet and just to provide basic necessities for their children. I do want to mention the earned income tax credit is also a refundable tax credit, meaning that the earned income tax credit can reduce the federal tax on your tax return to zero, and any leftover credit is refunded to you. But it is important to note that a worker must file a tax return to get the credit, even if their income is below what we call the legal filing requirement. So to qualify, workers must have some sort of taxable income from some sort of work in order to receive the earned income tax credit. And one thing I wanted to note as well, if for some reason you've not filed a tax return, you can retroactively go back 3 years from the due date of the return and receive any refunds due you from that time. And let me just advance this. Some more information about the EITC. It's, like I mentioned, it's changed a lot since it was enacted in 1975. President Reagan signed an extension known as the Tax Reform Act, and this indexed the maximum earned income and phase-out levels to inflation. And Congress, over the years, has further made it more generous with the maximum credit of a worker now being almost $6,000 compared to 1978 when it was about $400. However, in index for inflation, that would equal about $1,400. And also, President Reagan did call us at the time that the earned income tax credit was the best anti-poverty, the best pro-family, and the best job creation measure to come out of Congress. As you can see, some of the statistics on this slide, there are 27 million people that received over $65 billion last year. And there are a lot of people that were also lifted out of poverty because of this, but we also want you to note that we're missing people because of various reasons. Our earned income tax credit office has done some research along with some other organizations that we work with, and we found out that there are many people that don't claim the credit because they move in and out of work. You have people, especially in the economy that we've had, where people have gone from a two-wage earner to a one sole provider of income, people getting married, divorced, having children, and everything else. So people move in and out of levels for the earned income tax credit, and we want to make sure that we hit all those people and let them know about this very important credit. By the way, Mike Wade, who's on the call, is our earned income tax credit subject matter expert on this. I'm just providing an overview, but he works very closely with our office in the earned income tax credit division. So the maximum, this slide just basically shows that the maximum credit for this year, which can be worth up to $61.43 with 3 or more children, and almost $500 with no qualifying children as well. And on this slide here, the maximum earnings for 2014 shows the differences as far as filing status and your children. Obviously, you can tell from the disparity in some of the amounts that you receive if you're childless versus having up to 3 children. There is the maximum amount of EITC you can receive is or does provide more money, awards more money to families with 3 or more children. And like I said, this just gives you a breakdown of filing status and earned income tax credit. This is more for your information more than anything else to keep handy. It's kind of a useful reference. I did want to note some special rules for people with disabilities with the earned income tax credit. And generally, well, first of all, you must have a child or adopted child or any of the above that's on this slide in order to qualify, have a qualifying child. However, normally the child must be under 19 or under the age of 24 and a full-time student. However, if the person is considered permanently and totally disabled, that means that there is no age limitation for claiming a qualifying child, which is great news for someone that may have a disability in your home, that could be an adult that is 30, 40 years old, but not able to care for themselves, and you could still claim that person regardless of their age. So that's an important note that I wanted to point out. That's why I put it in this slide. Also, President Obama did sign into law a few years ago, in 2013, the American Taxpayer Relief Act of 2012. And basically what that said was that any income received from the Earned Income Tax Credit or any other credits received on your return, it does not count as a resource for you for a period of 12 months. And the reason this is important because there are a lot of people that do receive public benefits, and it could harm people as far as receiving these benefits. It could somehow, if they're on certain public benefits, it could, if their resources are too high, Social Security will automatically go in and just cut the benefit off for that month or even more, and it may take a while to get it back. I mean, I can tell you from personal experience, I never had benefits taken away from me, but I remember when I was, after I was out of college and getting ready to go to work, and I had a great fear of losing my benefits because my parents couldn't incur the cost that was involved for hospital bed and some of the nursing care that I had in the beginning. So I remember going down to the Social Security office, and I was concerned, not so much the amount of money I was receiving from SSI, but I was more concerned about my medical than anything else. And I basically asked them, I said, you know, what can I do? And they assured me that I could go to work for a 2-year period, and if I felt that within 2 years I couldn't do it, to come back to them, and you know, everything would be restored. And to make a long story short, I am now in my 33rd year with the IRS, and I'll be eligible to retire this May, but I probably can't afford it. But I just wanted to mention that only because there are similar things in the law now. I mean, of course, many things have changed over the years, but there are still similar provisions where you can work and not lose your benefits. And that's why this law, I think, is very important. Although it says that it's been permanent, from the research that I've seen, this actually goes to about 2017, so something will have to be done at that time more than likely. One other thing I wanted to talk about the Earned Income Tax Credit more so is our website that we have that's available for people as far as the Earned Income Tax Credit. There's all types of resources that are available. We have in this partner toolkit on EIT Central, we call it, we have many materials that are available. We have marketing tools, news releases. If you want to find out information about your state, I was going to include some information about Hawaii on yesterday's call that I provided with them, or there's too much information. But, you know, the same here. There's where you live, you can go in and look at local statistics. And also I wanted to mention that this next week, January 30th, is what we call Earned Income Tax Credit Awareness Day. And we asked many of our partners to help us promote this day and just to spread the word about the Earned Income Tax Credit. And so, you know, this, like I said, this source, I suggest you check it out because there's a lot of information there. I won't go into some of the other things that are on there, but there's a lot of information available at that site. And this is actually a separate site from going to irs.gov. However, this is probably a little bit more user-friendly for taxpayers because everything's written in plain English. So, having said that about the earned income tax credit, there's many other credits that, because of time, we can't talk to you. But, why do we consider free tax preparation services important? We know that there's literally tens of millions of low-income Americans that use a pay preparer. And on this slide, I want to talk about some of the issues that are out there. There's many competent tax preparers. However, we want you to, when you file your tax return, we want you to keep all your money, no matter what it costs to prepare a return. Now, there's, of course, some preparers that may not be as scrupulous and do charge exorbitant fees, or you've probably heard the term rapid refund. There is no such thing. It's basically a loan. And in some of those situations, we're asking you to utilize some of our free services. 70% of the earned income tax credit eligible taxpayers, use a pay preparer. And, we feel that once you receive, if you're eligible for your earned income tax credit and the child tax credit and some of these other credits that go along with it, it's going to be the most amount of money that you may see at any point in time that year. And we feel that's the important time to think about some strategies as far as saving some of your money, and we call it an opportunity to link to asset building strategies. So some of our services I've already mentioned, our main program, the Voluntary Income Tax Assistance and Tax Counseling for the Elderly, but I'll just go over a little bit more in depth on some of the programs that we offer. And with the Voluntary Income Tax Assistance and the Tax Counseling for Elderly, this is a face-to-face model where the taxpayer sits across from an IRS-certified volunteer who prepares the return. So that's the model that we've had for 40-some years. And we've added some new things because of technology, such as what we call virtual VITA, and that's basically where the taxpayer electronically sends documents to IRS-certified and trained volunteers, and they prepare the federal and state returns. They discuss the outcome of the return. They help doing the electronic filing of the return, and if the taxpayer agrees with everything, they sign the return. There is no face-to-face interaction. It's done virtually, whether it's Skype, telephone, whatever. There's also, we have on our website, IRS Free File, where the taxpayer can self-prepare and file the federal and state returns themselves without the assistance of anyone else. Now, the taxpayer can go to our Free File Alliance website, where there are various types of commercial software providers that can be used to prepare a federal tax return for free. Last year, well, I did already mention that we prepared. I'm saying our volunteers and our partners prepared over 3.6 million tax returns, and that returned over $4 billion in refunds. But just as importantly, it saved in about approximately $1 billion in saved preparer fees. So we consider that very important. And finally, as far as some of the alternative tax preparation, there are a few models that we have out there where a taxpayer, if they meet the income criteria, they can self-prepare a federal and state return with the option of utilizing the IRS certified and trained facilitators to assist with any tax law questions or technical assistance with the software. We also have, if you're a low or moderate income taxpayer with a simple tax return and just need a little help with access to a computer, we can offer IRS certified volunteer to guide you through the process and provide access to a computer. And basically all you need to do is just bring your documentation into a free tax preparation site, and we'll help you get started from there. Some of the benefits of people that use some of the services is it just helps you prepare. Well, you get assistance from IRS certified volunteers. There's reduced wait time if you're going to a face-to-face tax preparer. It increases education and understanding about your own tax return and builds confidence to file without assistance of help. So those are some of the programs that we have for free. And I did put this one slide here just as far as our signature program, just to show you that there is an income limitation, $53,000 and below for that. However, there are cases where that income limitation of $53,000 is more of a guideline than anything else, depending on the VITA site and how busy they are, or how if there's a lot of people waiting. We did receive something from our headquarters last year that said that as long as your tax return is considered in scope, and by that we mean it meets the levels of our training, it can be, the income can be a little bit more than what's on there. Obviously, we don't want people utilizing this service if their income is you know, a couple $100,000. That's not what the program was meant for. So that's kind of why we have a guideline of $53,000, because that's the maximum earnings for your income tax credit. I want to mention too some of the tools that we have where you can find a volunteer income tax assistance site or a tax counseling for elderly site close to you by going to a couple of links that I've provided or calling a number. We also have a new or updated app, I should say, that's available for iPhones using iTunes or an Android phone using Google Play, where you can search on there through the app. It has maps and everything else. The application is probably the most used for trying to find out when you're going to receive your refund. It also has some new information. The app was just updated. It hasn't been released yet. It'll be released the end of this month, I've been told, where it's going to have some information on videos from our IRS YouTube channel. And we're also working with people that are deaf and hard of hearing, and it will be a link to American Sign Language videos as well on the application. I didn't list it here. I apologize for that, but again, the app is called IRS to Go. So it's IRS, the number 2, and GO. Another credit that I wanted to talk about that does involve certain people with disabilities that I think is very important is the Child and Dependent Care credit. Most people, I shouldn't say, I call this the babysitter's credit because most people just use it to enable them and their spouse to work. And if the child's under the age of 13, then the person can you know, claim this credit if they meet the other criteria. The exception to the rule is if the child is considered physically or mentally unable to care for themselves, or if the spouse cannot care for themselves as well, and the other person needs to work, you can actually claim this dependent care credit for an adult spouse if he or she cannot work. So, or if the child is over the age of 13, the same thing, as I mentioned with EITC, that age limitation is waived. So, I mean, I just think it's important just to reiterate, that's why it's called the Child and Dependent Care Credit, not just the Child's Care Credit, because, again, it is available to a spouse who cannot take care of themselves and needs assistance and allowing one spouse to work. Another important credit is the credit for the elderly or disabled. This is a very underutilized credit. for a lot of reasons. One is because to meet the income criteria for this credit, your income has to be very low. Generally, it has to be $25,000 or less, and that would be earned income. But there is a credit that's available for low-income individuals, if they're at least 65 or older, or if they have a permanent and total disability and their income is from public or private sector. And so the maximum amount for this credit is $1,125. Like I said, we don't see it a lot. It's not. I think there's a few reasons. One, like I said, it's because of the income limitation to receive the credit, and I'm just making an assumption that it may not be well known as well. Another important deduction that you can claim on your taxes are medical expenses. This year there was a change in taxes where it has to be at least 10% of what we call your adjusted gross income before you could claim any of these expenses. However, there's so many things that do qualify under this, such as the diagnosis, cure, treatment, or prevention of disease, a lot of things, wheelchair, cost and care of a guide dog, home modifications, many things like that. And I like to mention what I do is I try and get all of my medical expenses done in 1 year. So by saying that, I mean like the co-pays that I have for a wheelchair or anything that I have done to keep my vehicle up on maintenance, dentist, things like that. It's still hard sometimes to overcome that 10%, but I feel that's one way of doing it, and I talk with many people with disabilities. They try and do the same thing as well, so just so that you can claim it. Like I don't have dental insurance, and this past year my wife had to get an implant for a tooth, and that was $4,000 in itself. So without adding everything up, more than likely I will have enough to have a small medical deduction. But it's there just for your information, and depending on your situation and the type of medical expenses you have, you may want to keep your information on, keep all your receipts for any supplies or medications or health insurance premiums that you may have. And finally, the last credit I want to talk about for individuals is the impairment-related work expense. And this is if you have a physical or mental disability and it restricts you from being employed, and you need to have some sort of equipment or something. You may have to have an attendant to help you during the day, or you may have to have an interpreter, and for some reason your employer won't pay for this. This impairment-related work expenses can be claimed as an itemized deduction on what they call your Schedule A, and normally any itemized deduction under miscellaneous deductions is subject to a limitation. However, impairment-related work expenses are not subject to any limitation. So as I mentioned with medical, that's subject to a 10% limitation. There is none for impairment-related work expenses. And with that, I did want to mention some important business tax incentives that are available for employers and businesses. And the reason that I want to point this out more than anything is because you may have an employer, or you may know someone that is looking to get into the workforce, and these are some important credits that are available for businesses. So I'll start with the architectural barrier and removal deduction. And this basically, all these credits came about due to the American Disabilities Act. And this first credit encourages business of any size to remove architectural and transportation barriers to people with mobility, disabilities, and this tax deduction can be taken up to $5,000 in any year. Some of the things included under this expense include walkways, parking lots, ramps, entrances, doors, stairs, widening of bathrooms, lowering of water fountains, and the list goes on. Now, the disability or the disabled access credit is a credit that Congress enacted because they felt it was unfair for small businesses, and they define small businesses as someone with 30 or fewer employees or total revenues of $1 million or less. So many of the expenses I just mentioned under the barrier remover tax deduction can also be done as using the disabled access credit. And by that I mean if the owner of a small business has to put in a ramp or an elevator or any modifications to their business to enable people to enter their business or utilize the restroom facilities, that can be taken as a credit on their business tax return, and the credit can be worth up to $5,000. Now, the difference between a credit and deduction is pretty big. A credit is a dollar-for-dollar credit. So that means that if the person had $5,000 in tax due, this credit could offset that. It's not a refundable credit. So it kind of goes in conjunction with the barrier removal tax deduction because anything excess that you have over the disabled access credit can actually go to the barrier removal tax deduction. So if you had more than $5,000, obviously you can only take up to $5,000 for the disabled access credit, and anything else could be moved to the architectural and barrier removal tax deduction. I hope that's not too confusing, but it is. Taxes are confusing. And then, of course, there's the work opportunity tax credit, and this is a federal tax credit incentive that Congress provides to employers for hiring individuals from certain target groups who consistently face significant barriers to employment. And this is available to people with disabilities. Generally, they have to be affiliated with vocational rehab, or in some cases, though, they can just present letters from their doctor, and it provides the place of business with an incentive to hire people with disabilities. So again, I just encourage you to be aware of some of these credits, and if you need more information on the credit, I can get you more information on that as well. So financial education and asset building, as I mentioned before, this is probably for our partners one of the biggest things that they do as far as helping some of the people come in and getting their tax done. What we have at the IRS available, obviously we consider direct deposit as a financial education tool because it is the fastest, safest way to receive a refund. And in many instances, when you file your return, you can get your refund back in as little as 10 days. However, the official IRS word is that it could take up to 21 days, and of course, there's a lot of reasons for that because some people may get paper checks and that sort of thing. And of course, you may have heard about the budget situation with the IRS. But so our company line is 21 days or less. I just didn't change this on here because I think once everything gets straightened out, you still will be able to get your federal return back in 10 days or less. We also have split refunds where you can deposit your refund into 3 separate financial institutions. And in addition to that, there are savings bonds where you can purchase up to $5,000 in U.S. Series I savings bonds. And this can be not just for yourself, but you can have it for a child or a grandchild If your refund is over $5,000 and you want to purchase $5,000 worth of savings bonds, the remainder of the check that you have, now you don't have to purchase. I'm sorry, you can purchase it in increments all the way up to $5,000. $5,000 is the max. But so the remainder of any refund would be direct deposited or issued in a paper check. And that's all I have to give to you today. And my contact information is here. If you are interested in finding out who your local territory manager is or a local partner by you, you can email us at partner@irs.gov. It'll go to an inbox that is run by our communications staff, and they get that information out to the local territory, and you can contact them if you're interested in becoming a partner, or if you just need some information on some of the services that we provide. We also have if you're interested in becoming a volunteer, there is another email you can send it to, but you could also send it there as well. And any questions you have for me, my contact information is up there as well. So thank you, everyone.
Elizabeth, I think you might be on mute. We are still having trouble hearing you. Is your actual headset muted? Okay, we're going to move on to our next presenter. Let me get control of the slides here. Hi, Mike, are you there?
I am here. Can you hear me?
Yes. So our next presenter is Mike Wade, who also works with IRS Spec. And Mike, I'm going to give you control of the slides here.
Okay, great.
And take it away.
Hi, everyone. I want to thank you for attending today's presentation. Today I'm here to discuss two key provisions of the Affordable Care Act. And they're going to affect everyone's 2014 federal income tax return. These are the Affordable Care Act's Individual Shared Responsibility Provision, ISRP, and the Premium Tax Credit, or the PTC. We're going to cover a lot of information, but we do have an appendix at the end of the slides with information on the terminology that's going to be used today if you're not familiar with it, and resources on the two provisions we'll talk about today. As with any presentation, I have to make a little disclaimer, and the information that's contained in this presentation is current as of January 9th of 2015. You can visit irs.gov for tax forms, instructions, and general filing information on the Affordable Care Act. All the latest information about the tax provisions of the Affordable Care Act can be seen if you visit irs.gov/ACA. And we do this because there's been a number of changes throughout this last year with ACA, and we want to make sure that you have the most current information. So what I'm going to provide you with today is current as of January 9th, but there may be changes that take place throughout the year or in the next few years or whatever. So please visit irs.gov/ACA for the most current information. All right, so the agenda is I'm going to talk a little bit about the health insurance marketplace, just so you know what their responsibilities are. And then I'm going to go into the tax provisions that the IRS is responsible for. As I mentioned, the individual shared responsibility provision has both the minimal essential coverage and the coverage exemptions. We'll also talk about the Form 8965 for getting those exemptions. And then we're going to change gears a little bit, and we're going to go into the health insurance premium tax credit. We'll talk a little bit about eligibility, the advanced payments of the premium tax credit, and then the form for reporting your premium tax credit for this upcoming tax year, the Form 8962. And as I mentioned, there will be some resources at the end that will help you out if you missed something or if you're looking for additional information. So a little bit about HHS, the role of the health insurance marketplace. The Department of Health and Human Services, or HHS, is the lead agency for administering the Affordable Care Act. The IRS is responsible for administering the tax provisions that are included in the Act. So to clear that up for you, HHS is responsible for enrolling individuals for health care coverage through the health insurance marketplaces. They're responsible for helping individuals get the appropriate financial assistance, including the advance payment of the premium tax credit. We'll talk about that a little bit more. The marketplace is the main source for health insurance options under the ACA, certain exemptions from the individual shared responsibility provision, and they're the only source for advance payments of the premium tax credit. The second marketplace open enrollment period for 2015 health insurance began November 15th of 2014, and it's going to end on February 15th of 2015. The best place to find out more on HHS marketplace-related topics is at healthcare.gov. Healthcare.gov will direct users to both the federal marketplace and also to those states that have established their own marketplaces. All right, so the first one we're going to talk about for tax provisions that the IRS administers that'll have an impact on your tax return possibly is the individual shared responsibility provision. So what is it? What are we talking about as far as the individual shared responsibility provision? Under the Affordable Care Act, the federal government, state governments, insurers, employers, and individuals all have a shared responsibility to reform and improve the availability, the quality, and the affordability of health insurance coverage in the United States. So starting in 2014, the individual shared responsibility provision requires all individuals to have for each month in the year either minimal essential coverage, also known as MEC, or an exemption. If for any month in the year an individual doesn't have coverage or an exemption, they must make a payment for those months when filing their income tax return. But most individuals in the United States already have health coverage today that qualifies as MEC. And they're not going to have to do anything more than continue that coverage that they have right now. So who's subject to this provision? The individual shared responsibility provision applies to all individuals of all ages, including children. Every individual must address the MEC coverage requirement on their 2014 tax return. We'll talk about that a little bit later. And adult or a married couple who can claim a child or another individual as a dependent for federal income tax purposes, they're responsible for ensuring that all their dependents have minimum essential coverage or have an exemption from the coverage requirement. If they don't, they will need to make a payment for each month they or any of their dependents do not have coverage or do not have an exemption. Senior citizens are subject to these requirements, but both Medicare Part A and Medicare Part C, you may know it as Medicare Advantage, also qualifies as MEC. These requirements apply to U.S. citizens. It also applies to all non-citizens who are in the United States long enough to qualify as a resident alien for tax purposes. There's also those living abroad. If you're out of the country for 330 days of the year, you're treated as having MEC. Citizens who meet either the physical presence or the residency requirement need to maintain minimum essential coverage. They need to qualify for an exemption or make a shared responsibility payment. So let's take a quick look at this. This is the most important piece of this. Each person must have minimal essential coverage or a coverage exemption. Or if you don't have minimum essential coverage or an exemption, then you're going to have to make a shared responsibility payment on your tax return. I'm going to go over a little bit about minimal essential coverage, what that means, and then we'll get into who may be exempt, and then go over reporting of if you have to make a payment. So what is minimal essential coverage? Well, under our legalese Internal Revenue Code, there's a section 5000 Cap AF that spells out what type of coverage qualifies as minimal essential coverage. You can see the hopefully the categories on the screen here. The IRS has posted a chart listing specific plan types that meet MEC and those that do not on irs.gov/ACA. So you don't have to take notes on which plans are MEC as we cover them. Just visit our website. You can also check healthcare.gov. Plans that do meet MEC include coverage provided by an employer. This includes COBRA plans and retiree coverage. This category covers most group health plans, both insured and self-insured, provided by employers for the benefit of employees and their dependents. MEC includes coverage under most health plans purchased in the individual market and all qualified health plans offered through the health insurance marketplace. MEC also includes coverage under certain government-sponsored programs such as Medicare Part A and Part C and most Medicaid coverage, the Children's Health Insurance Program, or CHIP, and certain other government programs. As I said, you can find a complete list of government programs that qualify as MEC at our website at irs.gov/ACA. Now that I've provided you with examples of coverage that meet MEC standard, I'll cover a couple of health-related insurance policies that do not meet MEC. Generally, specialized coverage is not MEC. Some examples of those are coverage if you have it solely for vision or dental care, that's not MEC. If you have workers' compensation, that's not MEC. If you have an accident or disability policy, that's not MEC. Even Medicaid coverage that provides only specialized services like family planning, tuberculosis-related services, and limited treatment of certain conditions are not MEC. Like I said, you can find other examples of specialized coverage that do not meet MEC at the IRS website at irs.gov/ACA. The IRS has issued transition relief for 2014 for individuals covered or that were eligible and covered under some limited benefit programs. For more information, take a look at that for transitional limited benefit government health programs at irs.gov/ACA. As I said earlier, most individuals in the United States have health coverage today that qualifies as MEC and will not need to do anything more than continue the coverage that they now have. Individuals who have insurance coverage, as shown on the slide, do not need to purchase any other coverage to satisfy the shared responsibility provision. But keep in mind, for those individuals who do not have coverage or who anticipate discontinuing the coverage they currently have or who want to explore whether more affordable options are available, you may refer them to the health insurance marketplace at healthcare.gov. As I mentioned, that marketplace helps individuals compare available coverage options. They assess the individual's eligibility for financial assistance, and they'll find minimal essential coverage that fits their budget. All right, so for most of us that have MEC, how will the MEC be reported? As I mentioned, every individual must address the MEC coverage requirement on their 2014 tax return. All the 1040 forms are being updated so that an individual can either, one, indicate that everyone in the family had coverage for the whole year, two, attach a form to claim an exemption, or three, report and make the shared responsibility payment. Taxpayers whose entire household maintain minimal essential coverage for every month of the year will report that coverage on their Form 1040 when they file their tax return. If they had qualifying health care coverage called minimal essential coverage for every month of 2014 for themselves, their spouse if they're filing jointly, and for dependents that they claim, most taxpayers will check the box on their Form 1040 and leave the entry space blank. So it's a matter of just checking the box. On the Form 1040, line 61 was updated. You can see it there, hopefully, where it shows that you're attesting to having coverage. You check the box. This can also be done if you're filing a 1040A. It's just going to be a different line. It'd be line 38. Or if you use a 1040EZ, you can do it on line 11. So just a quick example. Say Susie had employer-sponsored coverage, her employer-provided coverage for the entire year, and she checks the box on her Form 1040 when she files her federal income tax return. Susie has maintained minimal essential coverage. No payment or additional schedule is required. So she's all set. For those individuals who did not have coverage and who are eligible for an exemption from coverage, they will not check the box, but they'll refer to the instructions for Form 8965, health coverage exemptions, and we'll talk about those briefly here in a minute. All right, so there's a new form, an 8965, and that's for health coverage exemptions. You use this form to report marketplace granted exemptions or to claim exemptions with the IRS on your federal return. Keep in mind the IRS does not grant exemptions. The taxpayers are claiming them on the return. The Form 8965 must be submitted with a federal tax return to report exemptions granted by the marketplace and to claim exemptions with the IRS. I need to emphasize here that the IRS will accept requests for an exemption from coverage only at the time of filing. IRS does not grant an exemption from coverage by phone or by correspondence, so you're going to have to do it on the Form 8965. For purposes of the 8965, your tax household generally includes you, your spouse if filing a joint return, and any individual you can claim on your tax return as a dependent. Only one Form 8965 should be filed for the household, and it will be used to claim all individual and household coverage exemptions on the return. So there's a number of different coverage exemptions. I'm not going to go through them, but there's a full list of them can be found for the Form 8965 instructions or at irs.gov/ACA. What I will do is just mention a few of them, and you can look to see if there's any that may apply to you. So this is for individuals that did not have a minimum essential coverage, and they think that they may be eligible for a health coverage exemption. Exemptions that are available when you file your return is if you do not have affordable coverage. That means that your household income was less than 8%, or the coverage was more than 8% of your household income. You weren't lawfully present in the U.S. You did not have a filing requirement. If you don't have a filing requirement, you are exempt from minimal essential coverage. If you're a resident of a state that did not expand Medicaid, you may have an exemption if you fall below that percentage. So what qualifies an exemption? As I said, you have these here that are IRS exemptions, and you can see more about those if you go to the Form 8965 instructions that are available on irs.gov/ACA. But I will mention two hardships or two exemptions that only the marketplace can grant. So you're not going to be able to do this when you file your return. You have to do it before you file your return. And that's a member of a recognized religious sect consciously opposed to accepting insurance benefits, or if you have a hardship defined by HHS or the marketplace. So you'll have to go to healthcare.gov to see if you have a hardship. Some of the examples that they show is if you are homeless, if you were foreclosed on, if you had a death in the family. There's a number of factors. So those are the only two exemptions that the marketplace can grant, and you'll have to do that before you file your tax return, or at least apply for it at the time of filing your return. If there's a couple of exemptions that can be done both by the marketplace and the IRS. Those are if you're a member of a federally recognized Indian tribe, part of a healthcare sharing ministry, the individual is eligible for services through an Indian healthcare provider, or if you're incarcerated. On those that can be provided by both the IRS and the marketplace, claim those on 8965 as part of an exemption for your return. Don't go to the marketplace because you can apply for those on the tax return. To get a better idea of those or to find out more information about the exemptions, like I said, you can go to the instructions for Form 8965, and they have a chart there that you can look at, and it'll have who grants the exemptions, the coverage granted by the marketplace, whether you can claim it on the return, And in those cases where it shows it both for the marketplace and on the return, do it on the return because returns are being filed now. It may take a while to get a exemption back from HHS or from the marketplace. All right, so how will IRSRP be reported? Let me just recap it. An individual will notify the IRS that they have MEC or minimal essential coverage, or that they have an exemption. Or they'll make an individual shared responsibility payment when they file their 2014 federal income tax return in 2015. Taxpayers who had MEC all year will indicate this on Form 1040 by simply checking the box in the Other Taxes section we showed before, line 61 on the Form 1040. If you did not have MEC all year, you may claim a coverage exemption using Form 8965. You can request coverage exemptions from the IRS, and you can report on their exemptions received from the marketplace. Taxpayers who did not have coverage for the whole year and were not exempt will have to make the shared responsibility payment with their 2014 tax return. There's worksheets located in the instructions for Form 8965 to figure out the amount of that shared responsibility payment and the amount due. The SRP, or shared responsibility amount due, is reported on Form 1040, line 61, in the Other Taxes section. I decided not to go through and show you any calculations on the payment. If you didn't have MEC and you don't have an exemption, the calculation of that payment. And I did that purposely because it gets a little too convoluted and it takes a lot of time to go through, and we're very limited on time. But as Richard had mentioned, if you're filing your return electronically, there's a lot of things in those preparation softwares that make it very easy to file your return, to make it complete and accurate, and they will walk through or guide the preparer, whether it's at a VITA site or a TCE site or at a paid preparer, to calculate if you do have a shared responsibility payment and what that amount is. All right, so I'm going to shift gears now and go into the premium tax credit. So the first part was about everyone. Everyone has to have minimal essential coverage, or they have to have an exemption, or if they don't have either of those, they're going to make a shared responsibility payment. So that's going to impact everyone that files a tax return for 2014, this year in 2015. The premium tax credit is a little different. It doesn't apply to everyone. So let's talk about what it is. To be eligible, an individual or family member must have enrolled in insurance through a federal or state health insurance marketplace. It helps individuals and families with the cost of purchasing their health insurance from the marketplace. Their household income, and we'll take a quick look at that, must be between 100 and 400% of the federal poverty line for their family size. But there are some exceptions for those that fall under 100%. But essentially, the premium tax credit reduces a person's out-of-pocket cost incurred for health insurance premium. That's why they came up with this wonderful premium tax credit name. The credit amount is based on a sliding scale, with a greater amount of the credit available to those with lower incomes. Other factors that affect the credit include family members enrolled, the cost of available insurance coverage, and the premiums for the plan that ultimately is enrolled in, and the family size. As you can see, an eligible individual purchasing insurance through the marketplace has the option to choose advance payments of the credit, which are based on an estimate by the marketplace of the taxpayer's premium tax credit, or they can choose an option to get all the benefit of the credit when he or she files a tax return at the end of the year. Keep in mind that advance payments of the anticipated credit are made directly by the marketplace to the insurer throughout the year before the tax return is filed. The advance payments of the premium tax credit lower the cost of health insurance premiums the individual must pay each month. Eligible individuals may choose to have the full amount or a lesser amount of the advance credit payments provided directly to the insurance company. Getting advance payments of the anticipated credit is done through an application process at the marketplace. The amount of the advance credit payment is based on the person's projected household income for the upcoming year, along with other factors such as projected family size, the address, who in the family is eligible for other non-marketplace coverage. Advance credit payments are likely to differ from the actual credit amount, which is based on actual household information when the return is filed. So it's a little cautionary here that for this reason, the advance credit payment amount must be reconciled against the actual credit amount on the tax return for the year. It's imperative that an individual report any changes in circumstances to the marketplace throughout the year so that the advance payment of the premium tax credit can be adjusted as appropriate to minimize any effect on the amount of refund or tax due at tax filing time. As I mentioned, taxpayers can choose to forego the advance credit payment and get all the benefit of the premium tax credit at the time of filing the tax return. Because the premium tax credit is claimed on the federal income tax return that is filed the following year, if you forego the advance credit payment, that means that, in effect, you'll get a reimbursement of a portion of the insurance premiums that you've already paid for a plan that was purchased in the marketplace. Taxpayers, including those who get advance credit payments, must claim the credit by filing a federal income tax return. Taxpayers who get the advance premium tax credit must file a tax return to reconcile or to compare the advance premium tax credit to the credit computed on the return, even if they're not otherwise required to file a tax return. So if you get advance premium tax credit, you have to file a tax return. The premium tax credit can reduce a person's federal tax liability and lower a balance due, or it may create or increase the amount of a refund because the premium tax credit is refundable. Richard talked about the EITC. The premium tax credit is also refundable. An individual who has little or no income tax liability can still receive the full benefit of the credit as a refund. And just to note here that the premium tax credit is not considered income for any federal or federally funded public benefit program. If an individual's actual allowable credit is more than what was advanced, the difference will be added to the individual's refund or subtracted from the balance due. On the other hand, though, individuals whose advance credit payments are more than their premium tax credit will owe the excess as an addition to their tax. There are some repayment caps if your income is below 400% of the federal poverty line. There's two new lines on the 1040 for the premium tax credit, so take a look at the 1040 if you get a chance at irs.gov, and you'll see where those new lines are. You can see them at line 46 and line 69 for the 1040. All right, with that said, let's talk a little more specifically about who's eligible and cover a little bit of new terminology. So to get the premium tax credit, an individual must meet all of the following. You or a family member enrolls, that's the individual, the spouse and dependents, in a qualified health plan at the marketplace for 1 or more months in which the enrollee is not eligible for other minimal essential coverage through an employer or government plan. You have household income between 100 and 400% of the federal poverty line based on your family size, and there are some exceptions. If married, you must file a joint tax return, and there's some exceptions there. You cannot be claimed as a dependent, and you must pay or have someone else pay the premiums by the due date of the tax return for the year of coverage. That includes extensions for 1 or more of those same months. Generally, married individuals cannot get a premium tax credit if they use the married filing separate status unless they meet criteria and temporary regulations. Those have to do with victims of domestic abuse or spousal abandonment. If you'd like to know more about that, you can take a look at the irs.gov/ACA. Generally, taxpayers' household income must be no less than 100% of the federal poverty line. But individuals who got the advance payment of the premium tax credit but then had their household income fall below 100% at the end of the year, and if this is because of a change in circumstances, they'll be treated as applicable taxpayers, and there's a special rule in which they will not have to pay back the premium tax credit. Key point to remember, many people already have qualifying health insurance that we talked about, the minimum essential coverage, through their current employers. If they have other non-marketplace minimal essential coverage, they do not qualify for coverage subsidized by the premium tax credit. Only taxpayers who or whose family members enrolled in coverage through the marketplace may be eligible for a premium tax credit. Here's the federal poverty lines that I had mentioned. These are for the 2014 income tax returns. The federal poverty line amounts that are in effect on the first day of the open enrollment period determined income eligibility for advance payments of the premium tax credit for the entire coverage year, and for the premium tax credit claimed on the tax return. Therefore, the 2013 FPLs that you see there were used to determine eligibility for the advance credit payments for the initial enrollment period that began October 1st of 2013. And they'll be used in determining the premium tax credit on the 2014 returns that are filed here in the next few months. The government will not use the 2014 federal poverty line until the second open season that began in November of 2014, and that's used for determining eligibility for the advance payment of PTC. So looking at this, the basic premium tax income limits for 2014, based on the 2013 FPL, you'll see one individual can go from $11,490 up to including $45,960, and then you see for two individuals, and then for four, a family of four, if your income is $23,550 or more, up to and including $94,200, you may be eligible for the premium tax credit. So individuals and families who make 100% up to and including 400% of the FPL for the year may be eligible for the premium tax credit. Let me give you a little example. The federal poverty line for determining eligibility for the premium tax credit in 2013, a family of four in Washington, D.C., as you can see, is $23,550. That means that the family of four could have household income of up to and including $94,200. That $94,200 is 400% of the $23,550, and they would be eligible for the premium tax credit. There are some key considerations that you need to take in mind if you're looking at the advance payment of the premium tax credit and having that sent directly to the insurance. As a part of the enrollment process, the marketplace will determine whether or not an applicant is eligible for the advance payment of the premium tax credit. But the applicant is the one who chooses whether to get the benefit of advance credits, the payments, and if so, how much. They can either get all of it paid on a monthly basis to the insurer, a portion of it, or not. Advance credit payments made to your insurance company are based on an estimate of the credit that you claim on your federal income tax return. So like I mentioned earlier, it's important to report changes in circumstances so that you get the proper type and amount of financial assistance, and to avoid a large difference between the advance credit payment and the actual credit that will be allowed on the return. Reporting changes in circumstances will allow the marketplace to adjust your advance credit payments, and that adjustment will help you avoid getting a small refund owing money that you did not expect to owe on your federal return. You should bear in mind that there are several important considerations involved with the choice to receive the benefit of advance credit payments. Advance credit payments are optional. Advance credit payments must be reconciled with the actual credit allowed on the tax return. Differences between that advance credit payment and the actual credit tax credit allowed are likely. Changes in circumstances can affect the differences between the advance and the actual credit, and that you must file a tax return to reconcile these differences and to claim the credit, even if you're otherwise not required to file a return. You're going to complete the Form 8962, the premium tax credit form, at the end of the coverage year to reconcile your advance payments and to claim the PTC. We're going to go over that here shortly. All right, so here's some new information that you're going to receive if you got insurance through the marketplace. What documents will you get? First form is the 1095A. The marketplace is going to send a Form 1095 Health Insurance Marketplace Statement. They should send that out by January 31st of this year for those that had insurance in 2014. Although the form will be new, The concept is similar to the Form 1099 interest, if you get that, or a W-2 that's reported, whereby one copy of the form goes to the IRS and the other copy goes to the individual. For example, the tax filer responsible adult will receive the 2014 information by January 31st of 2015 and can use this information to compute the premium tax credit on their 2014 tax return and also to reconcile the advance credit payments made on that person's behalf with the amount of the actual premium tax credit. If for some odd reason an individual does not receive the Form 1095-A from the marketplace, they should contact the marketplace to get a copy. They will need that 1095 to enter information onto the Form 8962. Because the 8962 is going to be submitted by taxpayers with their tax return, but the 1095-A will not. You're just going to keep that for your records. So the Form 8962 Premium Tax Credit, that's the second new form. It'll be used to claim the premium tax credit, regardless of whether any advance credit payments were made, and to reconcile the advance credit payments with the premium tax credit allowed. The process of transferring the information to the individual income tax return will be familiar to most of you. There will be new lines in the 1040 series return for claiming the premium tax credit. Reconcile the advance payments of PTC with actual credit amount, and for repayment of any excess advance payments on the premium tax credit. You're going to attach the Form 8962 to Form 1040, 1040A, and 1040NR. You cannot use the Form 8962 or the premium tax credit with a Form 1040EZ or 1040PR. There are several modifications to the Form 1040 series that taxpayers will use to reconcile advance payments and claim the PTC from the computations that are performed on the 8962. All right, that was a lot of stuff. Just want to remind you that the Affordable Care Act addresses health insurance coverage and financial assistance options for individuals and their families, including the individual shared responsibility provision and coverage exemptions from that provision, as well as the premium tax credit. In general, all U.S. taxpayers must have MEC for each month, qualify for a coverage exemption, or they're going to have to make a payment when filing the federal income tax return. Many people already have minimal essential coverage and don't need to do anything more than to maintain that coverage. Households who have MEC all year will indicate that on Form 1040 by just checking a box in line 61 in the Other Taxes section. Some coverage exemptions are granted only by the marketplace. The two that I had mentioned, you're going to want to go to the marketplace as soon as possible if you think you qualify for those. But for those exemptions that can be claimed on the tax return or by the marketplace, to go ahead and do those when you're filing your tax return. Coverage exemptions are claimed on Form 8965. A listing of exemptions can be found in the instructions for Form 8965. Any shared responsibility payment due is entered on Form 1040. It'll go in the Other Taxes sections. Taxpayers should use the shared responsibility payment worksheet and the instructions for Form 8965 to figure out the amount of the shared responsibility payment. The premium tax credit is calculated and the advance payment is reconciled on Form 8962. Taxpayers will receive the Form 1095-A from the marketplace, which will contain the information they need that's necessary to complete that Form 8962. Remember that only taxpayers who or whose family members enroll in coverage through the marketplace are allowed a premium tax credit. Eligible taxpayers may choose to get the benefit of the advance credit payments, the amount of which is based on their estimated premium tax credit, to reduce the cost of their monthly premiums. Taxpayers who chose to forego advance credit payments get all the benefit of the premium tax credit when they claim it on the return. A net credit or refund amount is reported in the payment section of Form 1040. Any excess advance premium tax credit that must be repaid is entered in the tax and credit sections of the Form 1040. Here are the major resources that I mentioned on the web, irs.gov/ACA for any of the tax provisions that are included in the Act. Healthcare.gov contains information about enrollment through the health insurance marketplaces, how to get appropriate financial assistance, which includes the advance payment of the premium tax credit. The attached appendix contains additional resources on both the individual shared responsibility payment and the premium tax credit. But I will not be covering them in today's presentation. Hopefully these will be sent out to you, but you can see some of the terms that were used, PTC resources there, and PTC glossary of terms. I thank you for hanging in there. That was a lot of stuff, and like I said, in this limited amount of time, we put quite a bit in there. Please refer to irs.gov/ACA for any additional tax provisions, and healthcare.gov for any of the marketplace provisions. Thank you.
Thank you so much, Mike. That was a great job and a lot of information, but really good and very important and timely. So we're now going to introduce our last presenter, Lori Shaler, who's here at National Disability Institute. Lori's a manager of financial empowerment and has recently worked as an ACA healthcare navigator and is here to just provide a few little details to each of you as you go through this process. Welcome, Lori. Thanks.
Good afternoon. Thank you very much, Richard and Michael. That presentation was very, very helpful. I wanted to move on. Here we go. So regarding this Affordable Health Care Initiative, I just wanted to go over the elements that are all included in the minimum essential coverage, and we can see how these services would be very beneficial for anyone who has a disability or is concerned about their health, and we can never foresee when our health status may change in the future. So all of these plans need to cover ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health, substance use and disorder services, including behavioral health treatment, prescription drug coverage, rehabilitative and habilitation services, and devices. So that can include any medically necessary appliances or things like a wheelchair, and then laboratory services, preventative and wellness services, and chronic disease management, and pediatric services, including oral and vision care for our children. And I want to urge people during this time of open enrollment, it's a wonderful opportunity to contact healthcare.gov, find out who the local providers are that help individuals to enroll through the marketplace, and see if you may be eligible for services. Any change in a life event may qualify you for enrollment in the marketplace within 60 days of the event. But right now, everyone can look at that marketplace and enroll before February 15th of this year. And that includes enrollment for a qualified health plan where we may get assistance paying for the premium, and there is additional cost sharing available for households where the income is perhaps less than 250% of the federal poverty guideline, and we can be determined eligible for Medicaid and Child Health Plus plans as well. So Michael had indicated that if we receive insurance through our through our employer, we have a plan that probably provides that essential coverage. But many families may not be aware that the household income may qualify them for plans like the Child Health Plus and Medicaid that can reduce their premiums even further. So I would like to invite you to get in touch with the local marketplace and see if you're eligible to apply. And enrollment for Medicaid and Child Health Plus is available throughout the year to make sure that, in particular, our lowest income households are getting the help that they need to have access to quality care. So I want to thank you very much for your time, and I'll leave this open for Elizabeth.
Great. Thank you so much, Lori. What an incredible amount today. Can you all hear me? So thank you so much, Lori. What an incredible amount of information for all of us to have received today. Even with the little technical difficulties we've had, I hope everybody found this to be a very useful bundle of information. Although it was quite a bit, remember that we always have the archive made available to you, and that you'll be able to review this information both by listening to it, by reading it on the screen, and by downloading the materials. So for those of you who had questions in the chat box, I sent you my email as they were mostly kind of really kind of in-depth questions. So we've asked for you to email them to me, Elizabeth Jennings, that's ejennings@ndi-inc.org, and we'll connect with our presenters today to email you an answer. Before we go, I want to say a special thank you again to our sponsor, Acorda Therapeutics. Their ongoing support of these webinars has allowed us to provide you with the MS Financial Wellness webinar series that you can access on our website, all of the archives for the past few years at realeconomicimpact.org/financial wellness. Thank you again to today's speakers, Richard Keeling, Michael Wade, and Lori Shaler. And thank you all for joining us today. We appreciate your time and attention. We hope this information has been useful to you, and we hope you'll reach out with any additional questions you have. Find us at realeconomicimpact.org or email me directly at ejennings@ndi-inc.org. And before we leave, a very special thank you to Nakia Matthews for getting us through all of our technical difficulties. We couldn't have done it without you. Have a great day, everyone, and good luck during this year's tax season.